Medical terminology and healthcare documentation are notoriously opaque to patients, and AI's ability to translate complex medical language into plain English represents a genuinely valuable application. However, this translation process is more fraught with risk than it might initially appear. The positive case is straightforward. When patients receive test results, pathology reports, or discharge instructions filled with medical jargon, understanding what they mean requires either Googling multiple terms or asking busy healthcare providers for explanations. ChatGPT can take a sentence like, "The CT shows a 3 cm hypodense lesion in the hepatic parenchyma with rim enhancement," and explain it as, "The CT scan found a 3 cm dark spot in the liver tissue that brightens around the edges when contrast dye is used." This immediate translation helps patients understand their own medical information. Demystifying consent forms is another valuable application. Medical procedures require informed consent, but consent forms are often written in dense legal and medical language that obscures what patients are actually agreeing to. AI can translate these documents into clearer language, potentially improving genuine informed consent rather than the current system of patients signing forms they don't really understand. However, medical language precision exists for important reasons, and simplification can introduce dangerous errors. The difference between benign and non-malignant might seem trivial to a layperson, but in some contexts these terms carry different implications. Benign typically means not cancerous and unlikely to cause serious problems. Non-malignant just means not cancerous, but doesn't imply harmlessness. A non-malignant brain tumor can still be deadly. If AI translations lose these nuances, patients might develop false understanding of their conditions. Small wording shifts in medical contexts change meaning substantially. "Your test was negative" and "your test was normal" sound similar but aren't identical. A negative HIV test means you don't have HIV. A normal chest X-ray means there are no obvious abnormalities, but some diseases might not show up on X-rays. Collapsing medical terminology into everyday language can obscure these important distinctions. There's also medical legal risk in AI-generated medical explanations. If a patient misunderstands their condition because AI provided an oversimplified or erroneous explanation, and this misunderstanding leads to harm, questions of liability arise. Who is responsible? The AI company? The healthcare provider whose report was translated? The patient for relying on AI? These questions don't have clear answers yet, which creates risk for everyone involved. The solution isn't to avoid using AI for medical language translation, but to do so with appropriate safeguards. Patient-facing AI-generated explanations should ideally be reviewed and approved by clinicians before patients see them. This adds a human verification step that can catch errors, clarify ambiguities, and ensure critical nuances aren't lost. For patient-initiated translations of their own medical documents, clear disclaimers should indicate that AI translations may contain errors and patients should discuss results with their healthcare providers. Including links to official medical sources alongside AI explanations helps users verify information and explore topics in more depth. If AI explains what a hepatic lesion is, providing links to established medical resources about liver conditions gives users pathways to more authoritative information. Another approach is developing specialized medical translation AI systems that are trained specifically on medical terminology with oversight from medical professionals. General-purpose chatbots like ChatGPT, while impressive, weren't designed specifically for medical translation and lack medical domain constraints that would reduce certain types of errors. Purpose-built systems with narrow focus and extensive medical training data might be more reliable. Healthcare systems should also consider providing official translation services for patient documents. Rather than leaving patients to use random AI tools, hospitals and clinics could offer verified AI-assisted explanations of test results, reports, and instructions. This brings the technology under institutional quality control and creates clear lines of responsibility. The fundamental tension is that medical language serves both precision and gatekeeping functions. Making it more accessible is good for patient understanding and autonomy, but doing so carelessly can introduce miscommunication and harm. AI translation of medical language is a powerful tool that requires careful, professional oversight to use safely and effectively.